It's like you're painting.
My name is Gloria. I'm 28 years old, and my addiction is bleach. I love bleach a lot. I ain't gonna say I love it more than I love myself, but I do love bleach. I don't consider myself a germaphobe. I'm not afraid of dirt. I'm not afraid of germs. I just like the feel of bleach.
Every day, Gloria cleans her house top to bottom with bleach. She goes through more than 300 gallons every year. Bleach has ruined her clothes and damaged furniture, but Gloria refuses to stop cleaning with it.
And I go and I wipe like my tables down, my stairwell down with it, cleaning the bathroom with it, my toilets, my sink, the tub in the kitchen. I clean my stove with it, my countertop, the refrigerator.
There's been times where I walked in the house and the bleach smell just slapped me in the face.
Gloria's addiction to bleach began 7 years ago while she was pregnant with her third child.
When I was pregnant, I used to take pieces of tissue and dip them in bleach and take them like pills. But my nutritionist and doctor, they made me stop doing it. And I thought it was just because I was pregnant and it'll go away.
But Gloria's bleach addiction didn't go away, and she's even taken it a step further. Every morning, Gloria now adds bleach to her bath water.
Every time I take a shower or a bath, I have to use bleach. I have to use it. I first run the water, then I take the bleach and I pour it in a tub. It's not a certain amount that I use. I just pour until I feel like it's enough. When I stay too long, my eyes have burned and my skin have tingled, so that lets me know that it's time to get out.
I get like a breakout of boils in like my armpit. It's something I would never wish on my worst enemy.
The worst one I've had was like the size of a tennis ball that was in my armpit. I've had one in my groin. It was like the size of a £2 coin. I feel like I'm rotting. I've got scars and holes all over my body.
Good morning.
Hi, thank you.
Not a lot of people know about this because he's embarrassed about it, so he will not say anything to anybody. He didn't tell me about it for a while until it got really, really bad. And it was causing him all these flare-ups and it's painful. And he's just not a happy boy. So how was your night?
It was sleepless. I was up half the night. Didn't really sleep.
Half the night, why?
Because I had the one on my side and on my bum, so.
Yeah.
I'm not who I used to be. I'm more aggressive. I'm a lot more sour. That's not helping me or the people around me trying to help me. I've been to my GP, but they can't diagnose me with anything. I really don't know what it is. I definitely feel like it has ruined my life because I can't do anything to stop me being mobile.
Tell me what's brought you along today.
Basically, I'll get these lumps or boils that form under my skin, and sometimes they can break through with pus or blood.
Oh, no.
The very first one was on my side. That went away because I popped it.
Of course.
Yeah, but that's the only relief I can get. But ever since then, it's just got more and more aggressive.
Yeah.
But the main areas that really bother me is my armpits and my bum cheeks.
What is this like when it's at its worst?
It's just, I can't bear the pain. Like, I
Yeah.
spend days in bed, run down or stressed. I've decided of work, I stopped going to the gym, and I don't take my boy out as much, so...
Yeah. Oh, Aldrin, that sounds pretty awful, so it does. And you've not had a diagnosis?
No one's diagnosed.
Okay, well, I'll need to have a look at everything so that I can give you the formal diagnosis and then hopefully come up with a plan that's going to start making things a bit easier.
I hope so too.
Let's look at the armpits first. Oh, yeah. You know, so you can see how angry the skin's been for quite some time. You've described them as boils, and that's kind of pretty correct. That's what they are, deep-rooted cysts. So whenever you squeeze these, bits of pus might come out of it.
Yeah, it does, like, it gets really big and it starts to leak.
Leak, which are the clue as to, you know, what's going on, really. Already, I know that this is something called hidradenitis suppurativa.
Okay.
Oh, yeah. All over, aren't they? Mm-hmm. And these are deep as well. You can feel the boils underneath. Hidradenitis suppurativa is a condition where certain follicles within the body, usually in the groin, buttocks, or the armpits, become blocked. And the products that are inside the follicles, they break down and start to cause an immune reaction, and you get lots of inflammation. And it usually presents as boils and abscesses, and it can cause lots of scarring. You know, this is what your normal skin looks like. It's perfect. And normally the buttock skin is even more perfect because it's just protected all the time. But it's much, much, much darker, telling me how much inflammation has happened here. Okay, Aldrin, I'll let you get back into your clothes now. Hidradenitis suppurativa is actually a common condition. Probably about 1% of the population might have this. It's also a condition that not too many people talk about. And because they don't talk about it, often it doesn't get diagnosed for some time. It is heavily associated with people who have anxiety and depression because it's such a burden, essentially, to carry around all the time. And usually it's built into your genetics. We can't change that, but we can control it enough that it doesn't bother you in your day-to-day life.
That's like the most I'm looking for. That would
Yeah.
be good enough.
So I'll give you some creams just to kind of help out with the skin. And, you know, these are very painful whenever they get inflamed.
Extremely.
So we need immediate pain relief that can kind of help you cope. And then I would quite like to put you on a medication to try and switch the process off for the pain point of view, and also so that you can go, right, okay, I can
Something's
stop being so
changing.
tired, I can do the things that I want to do.
100%.
So we've got a plan.
Yeah, I'm
and we're
happy.
on your side through
I'm
this
happy.
journey.
The best news, literally. And to know that there's steps to be taken to go forward towards it, that's even better.
Oh, good.
I'm here to see Dr. Emma today because it's my first checkup since I started the medication. To have someone listen to me and knowing what I have, it's made me feel better. I'm feeling positive and hopefully she'll see the results.
Hi, Aldrin.
You all right?
You all right? Yeah, come
Thank
with me. So, it's good to see you back.
Yep.
And you look quite different to when I saw you last time. Tell me then, how are you feeling now?
From when I first came in, obviously I feel a lot better.
Good?
I was depressed, grumpy, I had a bad attitude. I barely played with my son, I wasn't going to work, couldn't go to the gym. Now, everything is like 10 times better. I can sleep comfortably, I can walk properly, I can go training, I go and work. Constantly playing with my son.
Oh, good.
That's the best part about it. I tend to get a flare-up or two, but the pain is just so much better.
Good.
So much better.
Well, we're on the journey. Okay, can I have a little look? Is that okay?
Yeah, yeah, I guess
Grand. Okay, Aldrin, let's have a look. Is that all right?
Yeah, I guess so, okay.
Okay, have a peek. What a difference! This is great, isn't it? These ones here have all gone flat now. Brilliant. Okay, let's have a look here. Now, this side is amazing. Your skin looks lovely. No, there's nothing new at all here. This is all absolutely fine. That's so good. Okay, so now I want to have a look at the buttocks. Is that okay? Right. Again, this is really nice and flat.
It's a lot smoother.
Isn't it? It's much smoother. Very good. These ones now have all cleared, which is good. But this one and this one are a bit active.
And it's so sore.
So why don't I inject those ones?
Go on, let's do it then.
Yeah? Okay. So it's just a little steroid injection. Don't you worry. That will help to switch off the pain and inflammation a bit more quickly.
Okay.
So you'll just feel a wee tiny scratch and a wee tiny push, wee tiny push. There we go, done. And a wee tiny scratch, very good. That's great, well done, all done. You are made of tough stuff. Okay, Aldrin, well, things are looking really, really good. And with the medicines that you're taking and the creams, hopefully we'll get all of this completely clear for you. But I still need to keep seeing you just to make sure that things are all on the right path. Does that sound okay?
Yeah, I'm definitely up for that stage I'm at now from when I was. I'm more than happy.
Good. Okay, well, I'll see you then in a couple of months, okay?
Look forward to it. Obviously, I'm not done with treatment, but I know Dr. Emma's brought my life back to how it was and possibly make it better as well because I feel a lot more confident. See a big turnaround. Obviously, I'm happy in it. She's the best.